pharmacists are overly trained and underutilized. We've known that for years, and so my colleagues will know that the entry-level degree now in pharmacy is a PharmD degree, Doctor of Pharmacy degree, which is a clinical pharmacy position where I actually did rounds with medical students at the county hospital, and we are trained with them. And we take a lot of the same classes that they take, sometimes by the same professors: anatomy, histology, physiology, pharmacology, biomedicinal chemistry. And in fact, we're trained to actually read blood tests, and it's actually a part of the board exam that we can interpret these tests, and we can even order these tests. So, Doctor, you made it very clear that some of the warnings that the CMA has put forward is that you could have renal toxicity and hepatic toxicity, and using these preps if you're not being checked. You said we haven't seen one reported case of any type of toxicity in PrEP or PEP, which to me was very, very powerful. However, we don't take any chances when a patient comes in, and one thing that's important about PEP and PrEP is timeliness, acuteness, getting the patient on them, especially with PrEP right away and within 3 days on PEP. Otherwise, the patient is at risk of acquiring AIDS. So, Senator Wiener, this is not a unique idea that pharmacists are able to provide these medications. It's my understanding that this is available as you're proposing it in other states. Is that correct?
It is in New York and Washington State. New York is PEP, and Washington State is moving in the direction of PrEP.
Okay. Also, in response also to the doctor with respect to the hepatic and renal toxicities, there is a new drug that is being proposed to be released by the FDA. I don't know if it's out yet, but it is marketed to have less renal and hepatic toxicity. Maybe you could speak on that drug, if you don't mind.
I think you're referring to a drug branded as Descovy. It's another version of tenofovir that is in the treatment setting known to be associated with less frequent effects on the kidney. In the setting of PrEP, we have not seen renal failure associated with Truvada PrEP, the current formulation. The new formulation will have to be evaluated by the FDA to see how much it adds, if anything, to the existing standard of care. For now, we have Truvada. It is safe, and it is similar to birth control pills and vaccinations as a prophylactic intervention that has been safely provided by pharmacists.
So in the best interest of patient care, the pharmacist is going to be ordering blood tests at a bona fide lab and is referring a patient to their doctor. And if they don't have a doctor, by the bill, you're going to be giving a list of physicians that they can go see to follow up. We want them to follow up to make sure that they remain disease-free. Also, you know, we don't just magically say the pharmacist could start doing all these things without additional training. So in order for a pharmacist to give immunizations, we have to go through more coursework. We have to be certified before we can do it. We get a certificate. Should this bill move forward, the State Board of Pharmacy is going to come up with a curriculum, and working with maybe some of the agencies that were discussed before, to ensure that the pharmacists that participate in this program understand the protocols and follow through in accordance with pharmacy law, which will be enforced by the State Board of Pharmacy. The part that I like about this bill is that there's 5,000 new cases of AIDS every single year. And we got 1.1 million people that are potentially infected, and very few, like 10%, are even out there getting PrEP. And that's an access issue. We have over 5,000 pharmacies in the state of California. And we have pharmacies that are open 24 hours a day. And one doesn't plan always acts of passion. Sometimes things just happen, okay? And if you need PrEP, you need PrEP. If you need PEP, you need PEP. And again, we get back into the prior authorizations that take time. These are now really time sensitive. you know what you are going through, you know what you need to prevent your health from deteriorating. So I want to commend you, Senator Wiener, for bringing this forward. I know there's a goal that we should have zero. We need to eliminate AIDS like we eliminated polio. We've got the drugs that are safe and effective. We have proof that pharmacists have been able to take on more professional roles of prescribing and giving immunizations, and I think that's largely a success, that we've gotten more people, especially elderly people with flu vaccines, getting them the flu shot and preventing morbidity and mortality associated with that, or a pneumococcal injection for elderly people where many of them die from pneumonia when they're elderly. We've had a tremendous impact, and that accessibility, I think, is very important. We've got to stop siloing healthcare, especially when we have a primary care shortage in the state and in the country. I think with the appropriate protocols that the State Board of Pharmacy can do, and the increased accessibility, especially in areas of color where we see a higher percentage or preponderance of people that are getting AIDS unknowingly, not knowing that these preparations are available. I think we can reduce the morbidity and long-term sentence of patients that will come down with AIDS that didn't have to come down with AIDS. And so, Senator, thank you for bringing it forward. I would like to move the bill. I support it wholeheartedly, and I know that the California Pharmacists Association was here. They support it, I think, and I want to commend you, Doctor, on your pharmacy and all your good work. And there was also one in San Francisco that I was very impressed with that was doing a lot of great work as well. Thanks for your leadership on this. Okay. Dr. Grant, so if a patient gets on PrEP, we order the blood tests, and I think Dr. Pan brings up some good points that, you just can't look at creatinine, you can't just look at blood urine nitrogen, you got to look at some other things as well. And usually when you get these tests back, you usually see them highlighted. If there's something abnormal, usually you pinpoint it right away. But within that 30-day period, if somebody was having renal difficulties, would they be asymptomatic or would they be symptomatic in your viewpoint?
Well, the renal insufficiency would start off in an asymptomatic phase. With tenofovir, we haven't seen renal failure. We've seen abnormalities in serum creatinine. Typically, they occur 3 to 4 months after PrEP has started. Okay. It's not in the first month. And so the person would have transferred their care to a physician by that time, according to this bill, or they would have stopped PrEP.
The point I'm trying to make is they're not going to go into renal failure within the first 30 days of treatment, based on the literature that you articulated earlier, that you haven't seen anything like that in the past.
We've never seen renal failure, and in the setting of HIV treatment, we can see renal failure, and it typically occurs 3 or 4 months into therapy.
Thank you. And then Senator DeRosa asked some very good questions about, are we missing something? What can happen in as far as side effects of these medications? There's an over-the-counter drug that accounts for more poison control centers getting calls than any other. That same drug is responsible for 56,000 emergency room visits, 2,600 hospitalizations, and 458 deaths due to acute liver failure. Do you know what that drug is? Does anybody know what that drug is? Tylenol, right? So Tylenol is much more dangerous by far than PEP or PrEP. However, if one doesn't get PrEP or get PEP in a timely way, then they're in jeopardy of having a life-threatening infection if they don't get the proper medical care that they need and deserve. And so the other thing I wanted to also mention, and I know it's getting late, is the rural areas. I represent a lot of rural areas, okay? And you may not have a disease specialist out there that even knows what PrEP or PEP is. Out in Valley Center or in Blythe, I go all the way to the Arizona border. Yet we have pharmacies there, and we have pharmacy professionals that would have gotten this continuing education that can intervene, if you will, and refer them to a list of physicians. They may have to drive an hour and a half in 2 weeks after they get their blood test and go. But this has, I think, great benefits from Chico all the way to Calexico in the state of California. And for that reason, I want to move your bill, and I hope that we get a unanimous vote to move it forward.
Senator Grove.